is oral hygiene so important among children?
It affects the overall health of the child.
Even we have heard that 50% of children are having dental caries.
So you must have heard about flossing.
Another alarming symptom for the parents is bleeding from the gums.
And electric toothbrush usually.
What is the ideal oral hygiene practices for children?
Will start decaying the tooth.
What is the basic difference in these different toothpastes that are available for different age groups? Jai Shri Gurudev. Hello and welcome to BGSMCH Aarogya Vani. Your health, our priority. I am your host, Dr. Anu, Associate Professor, Department of Community Medicine. Today's episode of BGSMCH Aarogya Vani is for all parents out there who have young children. As a mother, I relate to that constant concern that comes when your child grabs a chocolate. That daily struggles in getting them brush their teeth. And we keep worrying within us, are we really taking care of the oral hygiene of our kids? To guide us through this topic, we have our expert from BGS Medical College Hospital, Dr. Sapna, Associate Professor, Department of Dentistry, specialized in pediatric dentistry. Hello Dr. Sapna, a very warm welcome to BGSMCH Aarogya Vani. We are delighted to have you with us.
Jai Shri Gurudev.
Jai Shri Gurudev. To start with, why is oral hygiene so important among children?
See, oral hygiene means health of our oral cavity. Oral cavity is nothing but mouth, right? So, health of our oral cavity means it is free of diseases, right? So, oral cavity is the mirror of our body. So, something bad with the oral cavity means there is something problem with our full body. So, it definitely have an impact on our general health. So, that's why it becomes for a children or for a child to maintain a oral hygiene is very crucial to prevent from any dental diseases like maybe dental decay or cavities or gum diseases and any malalignment.
Usually parents have the feeling that milk teeth is going to eventually fall off. So, is it actually required to take care of the milk teeth?
Oral health means how it affects the general health. See, if there is any problem in the oral cavity, maybe the teeth or the gums, so the child's food intake will reduce. The nutrition automatically comes down, and nutrition and the speech. So, teeth are very important for the speech development. So, that also gets affected. And if there is any early loss of milk teeth, so there will be malocclusion. So, which again the development of the jaw and the face will get affected. So, that's how it indirectly affects the overall health of the child. And it's very important to take care of the milk teeth, because if the milk teeth are fine, the permanent teeth which are underlying will erupt in a right age and in a right direction, and it will maintain the jaw and the face proportion also.
So, it's not that the milk teeth which is going to eventually fall off will just have an impact on the coming teeth, but it has an impact on the overall health of the child.
Yes.
Even the nutrition, even the speech,
yes,
which is very important in the growing years especially. Okay. What are the common dental problems that you see in children?
Most commonly, we see dental caries and gum diseases, and the third one, malocclusion. Okay. So, among the dental caries or dental cavity we call, it is very common. That is most commonly, if it in the initial stage, what will happen? The child or the parent will not notice that, so they may not have pain, so they will just neglect. And if it is neglected in the initial stage, and if it is untreated in that age, so it will start progressing further, and then it may lead to pain and infection. Finally, it may lead to loss of teeth in the early age.
Okay, even we have heard that 50% of children are having dental caries.
Yes.
What are the most common symptoms with which these children present to you?
Initially it will be mild sensitivity may be there for cold water or ice cream or to sweets. Okay, that usually adults, they express that sensitivity in the early stage, most of the adults. But children, we don't see that mostly because they don't express or they ignore that, or somehow it will get progress to the next stage. So next stage will be when the dental caries, when it goes more deeper and involves the vital tissues like pulp. So what will happen? There may be inflammation and infection of the tooth. So there may be pus accumulation and there may be swelling. So finally the overall health of the child also may get affected. So finally what will happen? There may be loss of tooth in the early stage.
Okay. So pain, swelling.
Yes.
These are the most common symptoms with which children come to you. For those having dental caries, right? Even sensitivity.
Yes.
Correct. So what are the other diseases other than dental caries and gum diseases that you already mentioned? What are the other diseases that you have seen in children?
Yeah, as I said, due to early loss of teeth, due to dental caries and the gum diseases. So what will happen if the milk tooth gets, it is lost in the early stage, the permanent tooth which is underlying, it may not come out properly in a right age, or it may be said that it may get impacted or it may get shifted to the other place. So there will be malocclusion. Mm-hmm. That means the misalignment of the teeth. So, and also this may lead to the abnormal jaw growth. So this is the other problem that the child may come up across because of the dental caries and the gum disease.
Another alarming symptom for the parents is bleeding from the gums. No, so few times if it gets even neglected, considering that it might be some minor trauma while brushing. What are the most common causes of bleeding gums?
Yeah, this is also, bleeding gums is nothing but the inflammation of the gums. We call it as gingivitis. So the cause for this is again the plaque accumulation. That is because the child is not maintaining the oral hygiene properly. If the child is not brushing properly and not removing the food that is getting accumulated on the teeth surfaces, the plaque will develop. So plaque is nothing but a layer of sticky layer which is forming around the tooth surface, which contains lot of bacteria. So these bacteria will definitely irritate the surrounding gums. So which leads to inflammation of the gums, nothing but the gingivitis. So that's why there will be bleeding. So the first thing what they have to do is, whenever the child or the parent sees that there is a bleeding, immediately you have to visit child's dentist so that it will be rectified and the proper cause can be identified.
So bleeding gums, this might not be only the improper technique of brushing, might not be the only cause.
Yes.
So always consult the dentist and then make a informed decision, right? Okay. We spoke of many diseases. We spoke of dental caries, we spoke of gum diseases and many other dental problems. And we were highlighting that oral hygiene practices are the root cause for almost all these diseases. Now let us come to the most important question. What is the ideal oral hygiene practices for children?
So first thing, before I tell about the oral practices, what age we have to start brushing and what age we have to clean the oral cavity is also very important. Okay. So as soon as the child is born, a newborn baby will not have teeth, right? But they have gum pads and the tongue has to be cleaned with a clean, soft white cloth. Okay. This becomes very necessary to keep the oral hygiene good.
So even before the teeth is erupted,
yes,
it is important to clean the gums.
Yes.
Okay.
And as soon as the first tooth erupts into the oral cavity, mostly it will be around the age of 6 to 9 months. Okay. The child may get the lower or the upper front teeth. Parents should start brushing. They can use a finger brush. We call it as finger brush, which can be adapted to the parent's finger. It has got a soft bristles on one side and on the other side it will be a roughened area. Okay, that is for the massage of the gums and cleaning the tongue. The bristles can be used to clean the teeth. So maybe the toothpaste may not be required in the early stage of brushing. So this is how they have to start with the brushing. Once the child grows and start getting other milk teeth, okay, gradually they can start or introduce a small head toothbrush with a soft bristle, okay. And once the child becomes 6 years plus or 6 years onwards, they can shift to the adult toothbrush because the child will start getting permanent teeth from 6 years onwards.
Okay, so that's clear. Even before the teeth erupts, we have to start cleaning the oral cavity using a sterile, soft cotton cloth.
Yes.
Yeah. Then we can shift to the finger brush and then gradually shifting to the regular toothpaste, toothbrush. Okay. What about the toothpaste? Because there are a lot of varieties of toothpaste that is available in the market. A lot of cartoon characters are there. Age will be mentioned on the toothpaste. What is the basic difference in these different toothpaste that are available for different age groups?
Yeah. There are different toothpaste available depending on the fluoride content. Okay. In an young child, like from 1 to up to 3 years, you can say, the child will not have the ability to spit out the toothpaste. So we can use non-fluoridated toothpaste.
Okay.
And the quantity of toothpaste also should be very less. We say a smear layer. A thin smear of toothpaste can be placed on the toothbrush and brush with a non-fluoridated toothpaste. From 3 years to 6 years, the child will start, will know, gradually have to teach the spitting also, okay. Then we can use less fluoride containing toothpaste. So they are available in the market which contains around 500 ppm of fluoride. So from 6 years onwards, it is necessary to use the adult toothpaste like 1000 ppm fluoride containing toothpaste.
So now we discussed about the toothbrush, ideal toothbrushes as well as a toothpaste, even the components in the toothpaste also we have discussed. What about the frequency of brushing?
Yeah, frequency, 2 times in a day brushing is mandatory. Along with that, if ideally after every meal, if you can brush, that is necessary, that becomes necessary. But sometimes it may not be possible because child goes to school. So it's very necessary to rinse your mouth after the child eats anything. Okay. So that the water cleans away the food and food accumulated on the teeth surface. Okay. Along with the brushing, it becomes necessary to clean the tongue and the gums also. So it improves the blood circulation, and even the coating on the tongue, the food whatever we eat will be deposited on the tongue. That can be cleaned.
Okay. So brushing twice daily, that is a recommendation. Yes. Along with the teeth, clean the tongue as well as the gums. And after every meal, rinse.
Yes.
So that is the key for a good oral hygiene. What are the other practices that you advise in maintaining the proper oral hygiene of the children?
Okay. So you must have heard about flossing. Okay.
Yes.
There are flosses available, but in a milk teeth stage, like when the child is having only milk teeth, there will be lot of spaces between the teeth. So flossing is not so much necessary because only with the bristles of the brush, the teeth can be cleaned. So after 12 years of age, when the child will have complete set of permanent teeth. So permanent teeth will have a tight contact, we say. So they will be attached to the adjacent with a point contact. So in that age, it becomes necessary to use a floss, dental floss. So it cleans the area between the teeth, because with the brush we can clean the chewing surfaces and the other surfaces, outer and inner surfaces, but not in between the teeth. So floss will help in cleaning such area.
We already discussed about the type of brush that should be used and the frequency of brushing. Is there any particular technique of brushing the teeth in children?
Ideally, there are 2 techniques which can be adapted. This mainly depends on how the child, it should be easy for the child to brush his teeth and it should be efficient enough. So one is circular method and one is horizontal. Okay. Circular technique is where to make the child make a circle in the air, big circle, and slowly go near the mouth and make it into small circles. That small circles to be adapted on teeth surfaces. Okay. So at a time can cover 3 or 4 teeth while brushing. Okay, this is circular method. One is horizontal method, that is like back teeth can be used using horizontal stroke, but this is only it is suggested only for children, not for adults.
Okay. So, is there any other particular technique that is advised for the adults?
Yeah, for adults, we say it as bars technique or modified bars technique. That means for the upper teeth with the small vibrations, up to down, okay. For lower teeth, down to up. So, this is the technique adapted in adults.
Okay.
Because this is difficult for a child to practice this technique. So, the simpler version of brushing technique is adapted.
And recently there have been a lot of advertisement regarding electric brushes, toothbrushes and various shapes of brushes. Some U-shaped brushes and all are there in the market. Does it actually make a difference? Is it that these sort of toothbrushes will provide a better oral hygiene?
Yeah, different shapes of brushes, it is always better to, if the dentist suggests or recommends that paste, that toothbrush. Ideally, if the child is taking braces treatment, so there is a different type of brush, so which is suggested by the dentist. Otherwise, regular toothbrush with a soft bristle or medium bristle can be used, and electric toothbrush we usually don't suggest in children, even in adult, for regular use, because it contains vibrations, but the amount of pressure, how much they apply, has to be monitored. If it is not monitored, there are chances of wearing off of the enamel. So, on regular basis, it is not suggested. So, regular toothbrush with soft bristle will be better.
So, it's not the type of toothbrush particularly that matters. Consistency,
yes,
and the technique matters.
Technique matters. How efficiently you remove the plaque and how frequently you clean your teeth, especially even it includes the water, rinsing with water. So, the idea is nothing should stay on the teeth after you eat anything.
Okay. Now, I'll put that most important question. What is the ideal oral hygiene practices for children?
First and foremost thing, twice brushing every day, and using a fluoridated toothpaste as I suggested before, depending on the age. Okay, and rinsing your mouth with water after the child eats anything, and avoiding or limiting sweets only during mealtime. In between snacks has to be avoided, and regular visits to your dentist becomes very necessary. So, these are the main key points we have to follow. Every parent has to follow to keep the oral hygiene, good oral hygiene in a child.
We keep focusing about the brushing. That itself gets troublesome at times.
Yeah.
But now we are aware that rinsing after every meal, even what they eat has an impact on the tooth. We spoke about the sugary food that causes dental decay. What about the role of diet in making our teeth strong? What are the diets that you advise?
Diet has a major role in the development of tooth and the gums as well. Okay, so before it forms or before it erupts, I can say during the formation of the tooth, a balanced diet rich in vitamins and minerals, especially calcium rich and phosphate, calcium and phosphate, and the vitamin C containing food, then the vitamin D, all these are helpful in making or forming the tooth more stronger and forming a healthy gum. Okay, so once the tooth erupts into the oral cavity, so the food that we take or the child consumes has a local effects. So if the child is having more healthy diet, maybe like fibrous containing fruits, nuts, vegetables. Okay, how it will help is, it will, while chewing all these, will increase the salivation, and mechanically the fibrous food will remove the plaque from the tooth. So that's how it improves the health of the tooth. If the child is more into sugary containing food, like maybe the sweets or the junk food, maybe we say it as easily fermentable food. like maybe maida or the processed food. Okay, all these will be easily fermentable by the bacteria that is present in the oral cavity and will start decaying the tooth. So these kind of food has to be avoided in a child, and encourage more healthy and fibrous food, including milk containing product, and maybe the cheese, paneer, curds, milk. All these are healthy for teeth.
All parents will agree with me, because processed food, junk food, avoiding completely is like an impossible task.
Yes.
But at least restricts its intake.
Yes.
And might be rinse the mouth and inculcate the habit of brushing after intake of such food.
Yes,
that can be advised.
That can be advised, yes.
And like the role of balanced diet in the general growth and development of the child, it has a similar effect in the development of the tooth as well.
Yes, definitely.
Yes. Before we conclude, Dr. Sapna, what is your key take-home messages for those parents who are constantly worried regarding the oral hygiene of their kids?
As a take-home message, try to inculcate good oral hygiene practices in your child, because as I explained earlier, that is twice brushing, rinse your mouth after every meals, and try to avoid sweets in between meals. Okay, and visit your dentist regularly, once in 6 months. So because a happy tooth is a happy mind.
Thank you, Dr. Sapna. Thank you for taking out time from your busy schedule and spending time with us in creating awareness in the community about this very important topic.
Thank you very much. 20th of March every year we celebrate as the Oral Hygiene Awareness Day, and during this time you have given me the opportunity to spread awareness among oral hygiene among children and the parents. So thank you very much.
So dear listeners, let us take a quick recap on the tips for oral hygiene. Start early. Clean your baby's mouth even before the teeth are erupted with a soft, clean cotton cloth. And once the teeth is erupted, use an age-appropriate toothbrush and toothpaste. Brush twice daily. Make it a habit. Guide them through this process. Supervise the technique of brushing. And most important, avoid sugary drinks and snacks. It has a very bad impact on the tooth, causing dental caries. Make the visit to your dentist regular. Try to incorporate regular dentist visit every 6 months. With that, we have come to the end of this episode of BGSMCH Aarogya Vani, your health, our priority. If you found this video informative, please like and share this video with your loved ones. If you have any doubts, please comment below. If you even want to incorporate any important health topic in BGSMCH Aarogya Vani, you can put it in the comments below. Until next time, stay healthy, stay informed. This is your host Dr. Anu signing off. Jai Shri Gurudev.
If you enjoyed this video, don't forget to give it a thumbs up, share it with your friends, and hit that subscribe button for more exciting content.